So what is manic disorder? What is mania? What is hypomania? We have already discussed depression. In depression, we saw that due to low levels of neurotransmitters such as serotonin, dopamine, epinephrine, a person usually have a low mood, loss of interest, insomnia, loss of appetite, weight loss. So due to low level of these neurotransmitters, the person develop the symptoms of depression. Now, mania is different from depression in a sense that in depression there is low mood, while in mania or hypomania the mood is elevated. Now, why the mood is elevated in manic disorder? The basic mechanism of mood elevation in manic disorder is that there is decreased activity of GABAergic neurons. GABAergic neurons or GABA neurons, they are inhibitory neurotransmitters. So when there is no inhibition, the person usually have an elevated mood, an increase in the energy, and loss of inhibition. So everything will be elevated, such as mood elevation, increased energy, and loss of inhibition, which will lead to overspending. And so these features are present in both mania and hypomania. They are common to both mania and hypomania. Due to decreased activity of GABAergic neurons, the person usually have a elevated mood. He is irritable due to a decreased GABAergic neurons. The person usually have pressured speech, flight of ideas, and poor attention. There is insomnia because of increased energy. There is decreased need of sleep, and due to loss of inhibition because of low levels of GABAergic neurons, increase sexual activity, overspending, and risk-taking behavior. So these symptoms, they are present in both mania and in hypomania. Then how we are going to differentiate between mania and hypomania? We can differentiate between mania and hypomania on the basis of 2 points. The first point is that in mania there will be psychotic symptoms. So the presence of these symptoms along with psychotic symptoms such as delusion or hallucination, then your diagnosis will be mania. So this is the first and the most important point to differentiate between mania and hypomania. Now, that is the presence of psychotic symptoms. The presence of psychotic symptoms will make the diagnosis of mania, and the absence of psychotic symptoms will make the diagnosis of hypomania. The second point is that the symptoms of mania last for 7 days or more than 7 days, and they cause significant functional impairment, which usually require hospitalization. While in hypomania, the symptoms persist for less than 7 days, typically 3 to 4 days, and they cause a minor functional impairment. So these are the 2 points on the basis of which you can differentiate between mania and hypomania. So elevated mood plus psychotic symptoms, the diagnosis will be mania. Elevated mood only, then the diagnosis will be hypomania. Low mood, the diagnosis will be depression. Now, if mania or hypomania alternates with depression, what does it mean? If low mood or high mood alternate with low mood, then our diagnosis will be bipolar affective disorder. So low mood only, depression; high mood only, hypomania; high mood plus psychotic symptoms, mania; mania alternating with depression, the diagnosis will be bipolar affective disorder. And we have already discussed that the main problem in mania hypomania is decreased activity of GABAergic neuron. So that's why in the treatment of mania and bipolar affective disorder, the drug of choice is lithium, because lithium increases the GABAergic neurons, increases the release of GABA neurotransmitter from presynaptic nerve terminals, and it also increases the GABA receptors on postsynaptic nerve terminals. Let me show you a diagram. You can see in this diagram, the mechanism of action of lithium is shown. So in mania and in bipolar affective disorder or in hypomania, there is a decreased activity of GABAergic neurons, which lead to abnormal elevation of mood, loss of inhibition, increased energy. And the gold standard treatment for bipolar affective disorder and mania is lithium ion. So lithium ion has two action. It increases the release of GABA neurotransmitter from presynaptic neuron, and it also increases the GABA receptors on postsynaptic neuron. So that's why it is used in the treatment of bipolar affective disorder and mania, etc. So this was all about a short revision of bipolar affective disorder, mania, hypomania. Because in previous lecture we were not able to record this part, so that's why to record this lecture we did a small revision. We have already done lithium ion and its toxicity and how to manage